We recently visited the Health 2.0 conference in San Francisco, and I interviewed some of the entrepreneurs there. When we come back from that video, I'm going to speak to Bruce Cohen, who is president and CEO of a company called VitaPath Genetics. So let's go ahead and roll that tape. We recently went to the Health 2.0 conference at the Hilton Hotel in San Francisco. A series of speakers discussed the impact of new information technologies on healthcare, while in the exhibit hall, companies displayed their latest products. We spoke to the leaders of some of these companies to find out what's new in this rapidly growing field. Carl Ulfers is the Vice President of Consumer Solutions at Optum Health, which builds products that foster better online communications between healthcare consumers and healthcare providers. Now, who are your customers? Is it the healthcare consumers or healthcare providers, or both?
Both. So we sell our services to employers, to payers, to providers, and then we service their members or consumers on behalf of those organizations.
Now let's talk about your new iPhone app, which is called Optimize Me.
Yep. And Optimize Me is really focused on helping consumers with their nutritional needs, from a weight loss perspective, from an exercise perspective, from a smoking cessation standpoint.
Now, what are some of the benefits that I could receive from this app?
So the benefits you can receive from this app as a consumer is, number one, it's focused on helping you improve your health and what you're specifically focused on.
Is this a multi-user situation where you're actually interacting with other people who have similar issues?
Absolutely. So you actually build your community as you go through this application, and that community key is always with you within the app, and you can just easily swipe it up with your thumb, and you can see your friends, you can see the challenges that you're in, other people that are participating with you, and then you can easily interact with them, whether it's giving them a kudos, which is a feature of the app, or a butt kick if it's one of your friends that hasn't been doing the work that they need to do.
Would it work with my local clinic? In other words, could I make an appointment with my local clinic?
So in the application, you can't. However, in the online experience that goes along with this, we've integrated into our partnership with American Well called Now Clinic. And so what that gives you the ability to do is, in 7 different states now across the country, we have physicians lined up directly into our online platform, and within one easy click from that platform, it automatically puts me into that virtual clinic, and then within another click, I can actually have a conversation with a physician about me, or as we see it most often, my family members' needs.
So what would you say is the biggest strength of your company? Is it the medical knowledge or the skill of the computer programmers?
It's a good question. We like to say that we're trying to bring the intersection of the science and the medical science and the art of understanding the consumer together. And then the underpinning of actually making that real is the technology and development that we have underneath it. And so the reason we feel we've got a differentiated value prop is that we are bringing both the mobile, the online, and the service experience from a coaching perspective, all together, all centered around the consumer's need. When it comes to healthcare, which is hard and confusing and complex for consumers, when they get a new time and need based off of how we've helped support them, we want them to be able to turn to us as that expert to help them through their needs.
I also spoke to Brent Poole, CEO of a company called MindBloom, whose online product seeks to improve your mental, physical, and spiritual health.
Well, MindBloom has a goal of making a way for people to live healthier, happier, more balanced lives, and we're doing that through a social gaming experience.
So how does that work? Let's say that I want to play this game. What do I do?
Well, you would go to mindbloom.com and you'll log into the experience. And I'll show you here in a minute what essentially you would do is we ask you to start to prioritize the different areas of your life, and with the input that we get from you, then we grow a tree that represents you, and then the game begins. The game is about growing this tree to a big and healthy tree, and then keeping it healthy, growing a forest of your family and friends, and keeping all of that healthy. This gives people a way to express themselves with words, music, and images. As I go back into this, here's my tree. Here's the sun and the clouds here. Sun for this environment is inspiration, and so as I click in, then there's a way for me here to go through and find other people's inspiration. We have all these really cute characters. We have a humblebee, we have a dragonfly, we have the enlightening bug, we have a scapegoat, these funny characters, and the enlightening bug comes in and sort of leads the person through the whole, and explains the currency and how the sun and the rain and all these other pieces work together. We created MindBloom so that our moms could use it, basically, and the idea was that with no technical background at all, you would have this very natural experience, and you would click in the places where you should click because you're drawn to them, and you would do the things that make sense to you. We do have incredible data about how people interact with this and how much they come back and the interactions that they have between each other, and all of that essentially says, wow, we've got an engaged audience. And what we're doing with that is selling this engagement platform to enterprise. And with MindBloom, we give people the way to really focus on any or all domains of their life at the same time. And in some ways, the tree that you grow becomes data visualization. And it's a representation of me. It's my priorities, it's my progress, and ultimately I can see like where I'm putting my time and energy.
Finally, I spoke to Damon Ramsey, MD, who is CEO of a company called Healthism, which offers online social networking tools aimed at preventive health maintenance.
So Healthism is what I would say is an early stage startup in the health information technology sector. And our focus is on providing a very effective and powerful preventative health platform. What we essentially do is provide personalized health advice, which enhances the user experience online. And we weave that personalized health advice into a social network for health goals. One of the things that you'll notice right off the bat is that we have a huge focus on user interface. And it's partially, I think, because of my own experience in leading this team. I know who my user is, and my user is generally a baby boomer. So I'm not designing games necessarily for them, because I know that that's not necessarily the most interesting thing. What we really focus on is creating that user experience, which is very, very easy to use. The other thing is our focus on technology that you already know how to use. SMS is a big portion of Healthism. Soon, phone is going to be a big portion of Healthism as well. And I think it would be amazing to be able to have an automated call that comes through and says, did you go for your walk? And you just press 1, and then that actually shoots off into your Facebook account, into your Healthism account, and also shares it with your health provider.
Now, some people who design technology products say that the ultimate test is that they can use it. Do you use it yourself? I
use it. Now, that's actually an interesting point. I have a very, very busy schedule. I wake up in the morning, I have 500 emails waiting for me. But I make simple goals on Healthism, and it's actually made a big difference. So one of them was to bike every day to work, which I made with my partner. And what we're actually doing is tracking it using the SMS platform that we've created.
Now, is this a social networking tool where you're in communication with other users,
Yes.
comparing notes with them?
Yes, exactly. So what happens is it's an interesting process from risk factor, action report, action item. And the action item funnels you into a group of people that also have the same issues. So if it might be that we're setting a goal for walking, well, you'll join as a walking group.
So do you feel that the fact that you've not only made a decision to jog a certain amount every day, but you've made that public and told this whole community of people that you're going to do that, does that make it more likely that you will actually do it?
I think you're touching on the main point there. It almost makes you accountable.